Next, we're going to talk about the forms within Matrix. So all these forms that we used to do on paper, we are now going to be doing in Matrix. To access those forms, we're staying right here in the Resident tab, just like we have been so far. We'll click on the Resident tab, and we'll come down, and our forms are broken into two different choices here. We have Events, which is going to be our hot charting, or we have our Observation. These are all of our assessments. So dealing with a new admission, we're going to go into observations first, and we are going to look at the nursing admission assessment. So I'm going to click on observations. Right now, if there was anything in the queue, and like I said before, this looks exactly like our progress notes, our vital signs. Everything will just build in this queue right here where it says short description. And right now, the resident currently does not have any observations. Okay, so we're going to add some observations to this. So to do that, we're going to click on Add Observation. And once we're in here, we have multiple options. If you see, they're broken down into categories. So we have activities, we have admission/readmission, dietary, discharge, transfer, or appointments, nursing, IDT review, social services, therapy assessments, and restraints/side rails. So these are how we break down the assessment, so it makes it easier for you to find them. Today, in this example, we are just going to be looking at the admission assessment that we will complete for Santa Claus. Right here we have two options. We have the 72-hour admission assessment. We'll get to that in a minute. And right below that we have the comprehensive admission assessment. So that's the one I'm looking for. All I'm going to do is click on it. And it brings me to the title page of this assessment. So right here, observation date occurred automatically offsets to today's date with today's time. If we were talking about something that already happened, maybe we already did this assessment, but a few hours later we were just now able to sit down and document on it, we would want to go back and change the time where it says observation time occurred. So make sure to keep that authentic with when it actually happened. Below here we have a short description. Sometimes we see some errors in this short description. What we want you to type in here is exactly what it's asking for, a short description. In this case, since it's a new admission, that would be our short description, new admission. The error that we see in this field sometimes is a nurse will try to write everything about the assessment in this description. Don't do that. It's a short description. Everything that you're getting ready to type in here, you're getting ready to answer inside of the assessment itself. So basically, you're just creating double the work for yourself. So let's not do that. New admission will be our short description. Right below that, if you look, we have an observation preview as an option. So if you're new to this and you're not familiar with all the observations that we provide for you to fill out, before we click next to say, yep, I want to do this, we can take a glance at this observation by clicking the plus sign. And it'll go through and it'll show every single question that is involved in this assessment. From here, you can read through and be like, okay, yep, this is the one that I want. So I'm just going to scroll back up to the top and minimize it by that plus sign is now a minus sign. Click on that, and it takes it all back in. At this point, if I said, yes, this is the one that I want, I would click next. If I did the preview and I looked at it and, whoa, I picked the wrong one, then I would hit cancel and go back and pick the right one. Okay. Once you click next, this observation is now a part of that residence chart. So make sure this is the one you want before you click next. We'll say next. And right here, we're looking at what we call the middle page. All right. So the middle page has a lot of information on it regarding this observation. And there's a lot of things that we can do on it. So the first things that we're looking at, if we're going to these blue navigational buttons, we have back as an option. View and update. This is how we open the assessment, and then we answer all the questions that are inside of it. So we'll get there in just a second. Report would allow me to print, just like in anything else in Matrix. That would give me a printable version. And mark invalid. So if I had opened this one on accident for the wrong person and I clicked next and now I'm sitting here, I would need to mark it as invalid. Right below here, where it says additional information, we have vitals for this observation, and we have progress notes for this observation. So this part's pretty cool. We already went through how to add a vital sign and how to add a progress note. But if the reason that you're adding one of those is because of an assessment or because of hot charting, then I'm going to show you an alternate way to enter those vital signs or that progress note. So vitals for this observation, we have two choices. We can add vitals or associate. Now we already took the admission vitals, remember? The one that we did mark invalid, however, was the O2 saturation. So what I'm going to do is I'm going to show you both ways here. If I were to add vitals for the very first time for this resident, then I would come in here and it takes us right to that vital screen that we were working on before. I know for a fact we already have temperature, pulse, respirations, blood pressure, weight, and height all in our vitals section already. The one we're missing was the O2 sat. So I'm just going to pick this one. And I'm going to come down to the bottom and click next. On the O2 saturation, we'll say it's at 98%. On the O2 sat, this is really important right here, oxygen use. If you were to say yes, then it wants to know the liter flow as well. If you look, I brought this up earlier and said that we would get to it eventually. The associate to events or associate to observations. If you look right now, we do have an observation that's available, and it has this little gray bar going across it. That means that it is currently going to attach this vital sign to the assessment. It makes it all one nice, neat package. It's pretty cool. So here's that. My date and my time taken. Again, if this was before, I would change this time to match when I actually did it. And I'm going to save. It keeps me on this middle page, and now if I look, there's my O2 saturation, and it's linked to this assessment. But if I were to jump over to the vitals from the resident tab, then that O2 sat would be in there as well. So it puts it in both places. Now, we want to grab the rest of those vital signs that we took on admission and add them to this as well. So if that was the case and they already exist, we don't want to add them because then we would be duplicating our work. If they already exist, we want to associate them. So if I click on Associate Vitals, there's my blood pressure, my height, my pulse, my respirations, my temperature, and my weight. Okay. So to attach them to the assessment, you'll see a little box to the left of each one of them. All I have to do is put a check mark in these boxes and click Save. Takes me right back to this middle page. And now if you look at my vitals, they're all linked. And if you look at them over here with this little flag, they all have a green flag that has an O in it, meaning that these vitals are attached to an observation. The progress notes for this observation, hold off on writing any notes about this admission assessment until you finish the actual assessment, because I will guarantee you that anything that you're going to write in that note, you're about to answer in the questions that we have waiting for you. Okay, so hold off on the note. We'll come back up here to the top. Now to wake up the assessment and to answer the questions that are inside of it, we need to view and update. So I'm going to click on that. It's going to open up the assessment for me. And now I'm looking at all the questions that I need to answer. Now in this form and forms like it, there are a few different types of questions that you're going to have to answer. We'll review those here shortly. If you look on the left-hand side, you'll notice that a lot of these questions have a yellow background. That means that they are required. You have to answer these before you can complete the assessment. So the first type of question we're looking at is a date or time or both in this case. You could type out the date right here, or you can use the calendar, and I could put the time of admission. The second type of question is a narrative box, where we just want you to type your answer out. So admitted from, we'll say St. Joe Hospital. Now watch when I click outside of this box, once I've typed something in it, the yellow will go away from the question. The question has now been satisfied. If we move down a little bit, the third type of question is, does resident have a post form, yes or no? So this is an either or type question. If I said no, the yellow goes away. I'm good with that one. The fourth type of question that we're looking at is something that has boxes. Now, when there's boxes, you can choose more than one answer. And sometimes if you wake up a box, then it is going to want a secondary piece of information for that answer. So in this case, resident welcomed and oriented to, check all that apply. So if we said call light, bathroom, meal times, activities, staff, and roommate, but notice that the call light, now it has a box that woke up next to it, and it says resident is able to use, yes or no. So anytime you see one of these, we're going to prompt you with a question that we need answered. We'll say yes. Now that I answered that, the yellow has gone away. So this assessment goes on for quite a while. So I'm just going to take the next, hopefully, minute or two and go through here and answer this as quickly as possible to show you how we can complete a form. So mode of transportation, ambulance, accompanied by, we could say sister. The resident assessment, they're oriented to time, place, and people. Mental status, alert, friendly. Jolly is not an option. Answers questions, we could say readily. Communication, clear speech. If I were to say use communication device or sign language, describe, then I would type in my secondary answer there. Are the pupils normal? Yes. Are they reactive to light? Yes. Eye condition vision, with or without corrective lenses. Say adequate vision. Right, left, or bilateral. Corrective lenses, no. Ears, is there redness? Is there drainage? Or none of the above? So I could say none of the above. Uses hearing aid or other hearing device, no. Ability to hear with hearing aid or other hearing device if normally used. Adequate, no difficulty. So you have multiple options to choose from. I'll say moist and intact. Denture use, does not. Dental, none of the above. Musculoskeletal. Again, I'm just going to answer these quickly so we don't spend forever on this. Continent prior to admission. Bowel sounds are present in all quadrants. Date of the last bowel movement that we know of. I'll put little slashes in here too. Usual bowel pattern, continent of bowel prior to admission, cardiovascular. Notice this vascular access device and comments. Some of these questions are not required. For instance, if there was no vascular device, then there would be no reason to answer this question right here. So sometimes you'll find some that are not required. When we get onto the skin conditions, non-wound and wound, and we answer them, notice that if it was a skin tear, it just wants to know the number and the location. And if you look at the gray box that's below all this, it says if areas of skin integrity, alteration, wound, and non-wound are noted on admission, measure each area and complete a skin evaluation event for each area. So we would not put in our measurements and all that good stuff right here on this assessment. We would need to open up our pressure or non-pressure wound event and talk about each one individually. This new form has been extended. The admission assessment used to be broken into 3 different observations, and now we have crunched it into one. So we could see personal habits now. The preference for bathing and showering. He likes to take showers. Usual bedtime, if we say yes, we have to list the time. We'll say 9 p.m. Are they currently experiencing pain? Resident pain interview presence. Have you had pain or hurting at any time in the last 5 days? So this is a pain interview. Please rate the intensity of your worst pain over the last 5 days. So since our resident didn't have any, I would just say NA. How much of the time have you experienced pain or hurting over the last 5 days? Resident pain interview, nonverbal indicators of pain. Pain effect on function. Over the past 5 days, has pain made it hard for you to sleep at night? So if our resident didn't have any pain at all, we could just say NA to all of these. Here's a fall history. Have they had any falls in the last month? In the last 2 to 6 months? Have they had a fracture from a fall? Do they have a fear of falling? Do they have a history of wandering or elopement from the home or facility? Do they have a history of pressure wounds? Weight loss? Absolutely not. All right, so that took a while. I know it did. Thank you for bearing with me on that. But we have now finished our nursing admission assessment. So every question has been answered, and I'm going to scroll back up here to the top and just look at them. There's nothing yellow that's popping up. So what I can do at this point is say save. Now, even if you were in the middle of this form and you had to go do something else, you would just click save. You could close this whole thing down, log off the system. When you log back in, this observation would be waiting for you, and you could select it and jump right back in and pick up where you left off. I'm done with it, so I'm going to say save. And the next step that I want to do after saving it, and it tells me up here across the top that it's saving. Now it's good. I'm going to complete the form. So now I did my entire assessment. I added vitals to it. And after answering all those questions, can you think of a nurse's note that you would write that didn't include the information that we already put in? If you can, then you could add a note. But if everything that you were going to talk about was covered up above, then you don't need to. To go back to the observation screen, I'm going to click back. And now I'm looking at the assessment that I just did. So it was a new admission. It was the ASC Comprehensive Admission Assessment. It was created by me. And one of the most important spots over here, completed, check mark, done. That's what we want to see. We want to see completed assessments. As these filled out and more became available, we could view observation history, and we could look at date ranges just like we did with progress notes and vital signs. The next thing that we're going to talk about are events. Events we will find under the resident tab, just like we have. We've looked into this for the vitals, the progress notes, the observations so far. Now we're going to look at the events. Essentially, the events work the exact same way that an observation does as far as filling them out. There's a few extra steps. But events, that's our hot charting. So anytime we have hot charting for a resident, we go to our events to talk about it. So I'm going to click on events. And right now I have nothing going on. So if I need to add an event, I'm going to click add event. And now we have a few options to choose from. Not nearly as many as the observations. So let's go through them real quickly. The behavior event, we have a new and worsening behavior communication event. Infection control, here's our infection control individual report. We also have a tuberculosis screening questionnaire. Under safety, we have a fall event. So anytime a fall occurs, we need to open up this event and document on it. New skin event. A dialysis appointment assessment. On the dialysis one, how it works, it's not really hot charting, but this is the only place where we could put it where we could get it to work how we wanted it to work. So with the dialysis appointment assessment, say you're on day shift and you're sending a resident out to dialysis, then you would open up this event and you would finish out the first half of it, which talks about anything that it needs to know from the nurse sending them out. Now, you wouldn't be able to complete it until the resident comes back. So if they come back on a different shift, so day shift sent them out, they come back on evenings, then evenings would get into the event that day shift opened, and they would finish the questionnaire and talk about the resident once they have returned and complete the event. Under documentation, we have hot charting, we have new order documentation, temporary care plan, or the SBAR, physician communication tool. Now, I know this one says hot charting, but keep in mind, everything in here is hot charting. We have this one, a generic one, just in case you needed to create hot charting on a resident for something that does not fall under one of these events that we have already created for you. Okay. The IDT weekly update skin events, so we have non-pressure wounds and pressure wounds. So these are our events, our hot charting. So for this example, let's say that our resident has a UTI. We call the doctor, we got an antibiotic, so we need to start this event for the hot charting. So over here under infection control, I'm going to pick the infection control individual report by clicking on it. Right now it has my event date and the time that it occurred. So if the time was earlier in the day and I just now got to sit down and document on this, we want to make sure we go back and change the time to when it truly did happen. So we'll say it was at 8:05 a.m. Don't worry about the stat priority box right here. The next thing in line says short description. So just like the observation, we just want to know why you're filling out the form. This is not the place where we're going to document your vital signs, your progress note, any of that stuff. No, we just want the reason, which in this case would be UTI. So we'll come down here and we'll click next. So it looks just like the observation. Here are one of the things that is different. We have the notifications section. So under notifications, before we get in here and do the view and update and answer all the questions, let's go through and talk about this stuff. So was the physician notified? Yes, they were. So once I say yes, it puts in my date, my time. I'll take it back to when I actually called the doctor. And if I needed to, I could add a note to talk about the conversation that we had. Was the family notified? I'll say yes. And I notified them after speaking with the doctor. Again, I could add a note to talk about who I spoke with. And the last thing was the care plan reviewed and revised as needed. So if we had a new order and we filled out the temporary care plan, then we did in fact revise as needed. So I'll say this happened at, say, 8:50. And we could add a note if we wanted to. At that point, make sure that you click save. If you don't, then it doesn't save your answers. So the notifications are very, very important. All right, so any event that we're doing, we have to tell the system that we talked to the doctor, we talked to the family, and we reviewed and revised the care plan as needed. By saying it in your note, if you were just to write a note and include that information, yes, it's in your note, but this is where we want that information. So just check the boxes, and that will relieve you from having to type out all that information in your progress note. All right, so I'm the nurse that's on when this thing first happened. So I did my notifications. Vitals for this event, I'm probably more than likely, I took a temperature, right? So let's say temperature. I click next. And for this resident, let's say they had a little bit of a temp. Notice that when I put in 101, it tells me that vital is out of acceptable range and that the acceptable range is anywhere between 94 and 100. So this will let you save it, but what it's going to do is going to turn it red, and it will make it more visible for management and everybody else involved so that we can make sure we follow up on this vital sign. So our route will say oral, and notice that the associated to events, just like it did in observations for us earlier, it is automatically linking it to our infection control individual report, which is exactly what we want. So again, this vital, I'm going to say I took it early, and I'm going to click save. So now if I scroll down, there's my vital sign, and if I were to go up here to the top and go to resident and go to vitals, there's the temperature that I just put in. So we talked about that earlier. So when you add a vital from the observation or the event, it will automatically go into the vital section, but it will, notice my flag over here, it will attach it to the event or the observation. That way it creates that nice, neat little package where when we needed to do follow-up, we could just go in and print the event and get all the vital signs, all the progress notes, all the information we need in one place. I'm going to go back to my events. And here's my UTI that I opened. So right now, notice under my completed category, there's no check mark. I haven't done the view and update yet, so I need to get in there and do that. So I'm going to click on my event by just clicking on UTI. It takes me right back to it. Everything that I did already is saved. So now I can click View and Update. Under View and Update, the first thing that it asks for are the signs and symptoms for this infection control report. So we'll look down here and we see, we'll say abnormal urinalysis, and the urine had a change in character. They also had a fever. All right, so there's a lot of signs and symptoms in here to choose from based on what you were charting on. Invasive devices, we'll say there was a cath, it was not cultured or x-rayed. Antibiotic, antifungal ordered, yes, we talked to the doctor. It was ordered today. Name of medication ordered. And then are there any precautions, droplet, non-airborne contact, so nothing in there. Notice it's not yellow, so we don't have to answer it. Just like the culture and the x-ray, these are not required questions, so if we don't have that information, we don't have to answer it. So that's all I had to do for this. So I'm going to go up here, I'm going to click Save, and Complete. It tells me that there are unanswered non-required questions, so that was the culture, the x-ray, the precautions. Do I want to mark it as complete anyway? Yes, I do. Now, if those were required questions, it would not have let you complete it until you answered the required questions. So there we go. I did my view and update. I started the hot charting, went and pulled antibiotic from the Pyxis or the EDK, started the resident on that. So if you were on physician orders at this point, we could come down here and we could click Add Order. We would put in the order for the Bactrim DS. And also we have a progress note. So if you are the nurse that started this, if you had something additional to say other than what we just did in the view and update, then you could click Add Note and write a progress note. So I'm going to go back, looking at this screen now. So we were day shift, and this is when we started the hot charting, was on day shift. Evening shift comes in. They're going to run their facility activity report. They're going to see that there's hot charting open on Santa Claus for this UTI, and they need to do their documentation as well on evening shift. So will night shift and every shift after that until our antibiotic therapy is done. So what evening shift will do is they'll come in and they'll go to resident and they'll go to events when it's time for them to chart. But we do not want them to come over here and add an event and start a brand new one. No. Day shift already created the hot charting. We just need to add to what day shift did. So as an evening shift, I would just click on UTI. I would come down here, vitals for this event. I would add my vitals. So let's say I did a temperature, and we'll say it came down a bit. I save it. So there's my vital sign for evening shift. At that point, evening shift nurse would need to write their progress note. So they're not going to do the view and update part. Day shift already did that. So the only way for every shift from here on out to document about this is to write their own progress note. It's automatically going to link it to the event. I save it. I'm back to my middle page, and if I look, there's my nursing note, there are my vital signs, and this will continue to build. So if this antibiotic was going for 10 days, then we should have 10 days worth of documentation from every shift about this hot charting. All right, so let's say that 10 days is up, and one of management's responsibilities for events and hot charting is to close them out when they are done. So let's say the 10 days has passed. We no longer have the need for the infection control individual report. So I'm a member of the management team. I will come in here and I will have the option to click close. It wants to know an evaluation note. so on. So we will put our evaluation note as to why this is closing out. We will click Close Event. It says if you close the event, you will no longer be able to add or change data, vitals, orders, or progress notes. Do you want to continue and close this event? Yes, we do. So now that event is closed out, and if I look at my current events, I don't have anything going on. If I ever needed to go back and say, look at this specific event, I could go to my View Event History right here at the bottom, set my date range, search, and anything that was closed would show up here for me. So if I need to pull this information and present it to someone or something, then I would say UTI, I would click on that, it would take me back to the event, and if I wanted to print the whole thing, I could just click Report right here on the middle page. And as soon as it's done thinking, I can print off everything that was completed inside the form, and it will also include all the vital signs, progress notes, orders, notifications, anything else that we did. So this is that nice, neat little package I was talking about. This is how we want things to work. So medication was ordered on 11/2 is the Bactrim DS. Here are all my notifications, all my vital signs that I put in. If I had put in orders, my Bactrim would be listed here. My 10 days worth of progress notes would be here. And at the very bottom, my evaluation note. Get printed off, and then I have it. Notice I'm using all these buttons to go backwards. All right. So now, essentially, that is vital signs.